Go ahead and tell us in the chat if you haven't yet, what brings you here? What health condition or autoimmune condition do you want me to focus on? And I want to make sure you know I'm here for you. So I'm Dr. Nancy Beliveau with Holistic Wholeness. Let's dive in. I'm going to go ahead and share my screen. As we start this, you may wonder what brought me here. So just a little background about me. Lindsay started to hear it. I had a lot of health issues growing up, and being that there were a lot of doctors in my family, I thought it was just normal to be tired when you wake up in the morning, to fall asleep when you sit down. Tell me in the chat if that's you. You're tired, can't keep your eyes open, you feel like you're hit by a Mack truck when you wake up. That was me. And my mom took me doctor to doctor, and they all said, everything's normal, right? Yes, Caro said. Christine said every day. Sarah said yes, mast. Oh, are you dealing with mast cell activation system, Carol? I saw mast. MTHFR, NASH. Okay. Let me know if that's you. Judy's also tired and fatigued all the time. And all the doctors said, we ran all these tests and went specialist to specialist, and they said, everything looks normal. Tell me in the chat if that's happened to you. You go to the doctor, you go to the specialist, you go to this doctor, you go to that doctor, you wait 6 months, and then over and over it's told, yes. Samantha said all the time. Christine said, yup. Okay. Tatiana said, yes, always tired with pain. Okay. So I bring that up because then it went from tired to bloated. Let me know in the chat if you ever wake up bloated, gut issues, bloated, gas, don't understand why. I was like bloated from air, water would bloat me. And I went to gastro. They did colonoscopies, endoscopies. They said everything looks great. Who knows what I'm talking about? Tell me if that's you. Okay. I bring this up because I kept getting doctors telling my mom, give her caffeine. She was feeding me 12 cups of coffee a day as a little girl, and I was still tired. Is that normal? No. And then the gastros were like, give her Miralax, give her fiber. And I just felt worse. I would go to the bathroom once a week. And then other times I'd have diarrhea and I'd have to wear black pants because I'd have an accident. So it's like, what's happening? They're like, nope, yeah, it's just normal. Finally, I was then one day, Lindsay, I woke up at 21. I just ran 2 miles the day before. I was a very active person. I was a competitive athlete. The next day I woke up and I could not walk. Anyone here with MS have that, where you were like me or one of my best friends, where you woke up and she couldn't even move anything but her eyes. She could not get out of bed. She couldn't turn her head even. Okay. I was rushed to the hospital and they were like, you have MS. You may never walk again. Here's some medications. Have a nice day. My mom was not having it. She's like, no, thank you. We did the medications. It helped me out of that flare. But those medications, tell me if this is you. You have an autoimmune condition and you're on medications to suppress or normalize your immune system or a biologic. They're all immunosuppressants, essentially. Tell me if that's you, if you're on immunosuppressant like I was. That immunosuppressant made me very prevalent to develop cancer. So then I actually developed a type of cancer. It was this whole mess. Okay, so we're going to be here for you, but I no longer have had an aggressive cancer come back like they told me I would. I no longer have MS, no longer on any medications. And then that's why I became a functional medicine and holistic doctor. And I'm going to talk to you today about that approach. Okay, so if you're skeptical, totally normal, totally okay. You're not alone. I was too. But let's go through this webinar. I'm here for you. I'm here for you tonight. So I want anything, if you just joined us, we now have another 30 people that just joined. Tell us in the chat what health condition you want me to focus on tonight. And between me and my team member, I see a lot of private messages coming too. I'll make sure I answer those. We're going to make sure we get to as many of your questions as we can. And then at the end of this master class, we're going to be together for about an hour. I'm going to give you the opportunity to book a free 15-minute consult with us. If I didn't answer your question, you can book a consult for free with our team to answer that. And then that consult can lead to an evaluation if you'd like, but doesn't have to be. Okay. The evaluation is normally $287, but we take $200 off. It's just $87. It's an hour-long evaluation with me or one of my other providers when you've seen this webinar. Let's dive in. Okay, I get that out of the way in the beginning so we can just focus on content, focus on you. All right, so let's dive in. I'm going to share my screen here. Perfect. Can you guys see this okay? Let me know in the chat. Can see it, can hear me. We're using a new platform. Okay, so Rebecca wants us to focus on fibro and lupus. Yes, I was diagnosed. Okay, Lindsay, thanks. I was diagnosed with fibromyalgia before the MS, which is, excuse my French, but like a BS diagnosis. It's real. It's a real diagnosis, but it's like they didn't find the root cause. They just call it that and gave me pain and peppy pills. It's like, well, what's causing the fibro, right? So we're going to talk about that. What caused my MS? What caused the cancer? What caused the lupus? What's caused the RA? Okay, we're going to talk about that. So if you're frustrated just taking a pill for every ill, our team will help you get to the root of the problem, the root cause, so that you can overcome this, not just live with it for life. And I know when we say overcome, it's really that you're going to not only feel better, but you're going to see the Hashimoto's or the ANA or those autoimmune markers start to come down like everyone else in our practice. Okay. How? We're going to talk about it. All right. Let's see if I can get this to go. There we go. Okay. So we're going to talk about overcoming autoimmune issues and freedom. Okay. Not just living with it and getting worse. Let's eliminate distraction. So make sure you're here. You don't have notifications going. If you're driving, you're cooking, pay attention for you, not me, because I do this all the time. So I know this stuff. This is about you. If you haven't told us yet, tell us why you're here so I can focus on that tonight. If you're skeptical, you have the right to be. We worked with Gloria, who is this very curvy Latina, and she was super skeptical. She had Hashimoto's, she had RA, she had osteoarthritis, she had fibromyalgia, just like many of you. She was super tired all the time, and she worked doctor to doctor, just putting on more meds. And she said, you guys actually showed me stuff that's natural that works. We got to the root cause of why these things were happening. We helped her have more energy so she could walk down the aisle, keep up with her grandkids at her daughter's wedding. Okay. You're not alone. Okay. We started with in-person offices in the tri-state area, the Northeast, and then we've actually expanded now to, in the pandemic, we work with people all over the globe. So wherever you are, as long as you have a phone, which it seems like you do if you're on this webinar or if you have a computer, we can work with you. We do lab work in the comfort of your home, and then we make sure we go over those results right from where you are. Okay. Here's a little bit background. This is me every day. I was always cold because I had hypothyroidism like some of you. I always had trouble losing weight. I had actually become anorexic to keep my weight at a roughly normal weight. Tell me in the chat if you struggle losing weight. Tell me if that's you. Okay. I had undiagnosed Hashimoto's. I had then been MS. I could not peel myself off the couch. Fibromyalgia. Okay. I literally was sensitive to light, migraines. I know some of you mentioned that. Okay. I had the worst periods. I would keel over, throw up, pass out, hit my head, almost bleed to death, chronically anemic, and doctors told me that's normal. Is that normal, guys? No. I also, because of those gut issues I mentioned, the gut not only is a big link to autoimmune problems and to brain health. So tiredness, all that is linked to often a gut problem that's not found by a typical gastro, but it causes skin issues. Okay. This is me after a steroid. This was just one spot. People are like, why don't you have a picture of that? You think I want a picture taken of me when my whole body looks like this disgusting skin problem? No. So this is just an example of one, but I actually usually in the summer had turtlenecks and scarves on because my skin looked like this everywhere. And it was vitiligo as well. I know some of you mentioned vitiligo, and it was just a whole mess. So I want you to know if you're feeling skeptical or like, oh, she's just like some perfect little skinny white chick. No, I had been 40 pounds overweight, fibro, MS, all sorts of problems. And then here I am because someone helped save my life. And then I said, I want to pay this forward. So for the last 15 years, we've been helping thousands of cases, just like some of yours, the way that one doctor helped me. Okay. What we're going to cover tonight is America's healthcare crisis, the root cause of a lot of the health conditions you guys mentioned, and the root cause of most autoimmune issues, how to overcome them naturally. And then at the end of this, you can book a free 15-minute consult with our team. And that basically is to just really understand if we can help you or not. We'll be honest with you. Okay. Is that fair? If we don't feel like we can help you, we'll tell you. Before you spend any time or any money on anything, we want to be straight up. Let's go through this webinar and get through the information and content because I'm here for you and I want to help you. But when you stay to the end, we'll let you book over the next 2 days. We have multiple 15-minute consult spots that you can book with us for free. And then that leads to, if we feel like we can help, an evaluation with me or one of my other providers. It's normally $287 for the hour-and-a-half evaluation over Zoom. But we knock it down to just $87. We take $200 off when you book this free consult tonight to help you guys out. Okay. So this webinar is for you if you're overwhelmed, exhausted, not feeling as good as you know you should. You know you need to do things differently, but you can't figure out how. Like Mary, you just literally crave sugar. You were on Ozempic and now you gain the weight back, like Catherine and Rosetta said. You don't know where to start. Okay. It does not come in a magic injection or pill. Okay. Like Lisa, you mentioned you're dealing with autoimmune labs indicate it's probable, but the Western medicine is just not supportive. A1C, prediabetes. Okay, tell us if any of these things are you. Okay, and you're willing to take ownership of your health. You're in the right place. Okay, anyone feel like this? We asked you earlier, but we just had another 30 people join us now. We're up to 170 people. Did you ever feel like this, where your labs say you're normal, but you don't feel normal? Or like Catherine said, I have prediabetes and like this A1C and then this autoimmune marker on my labs, but I don't know how I got this. You can use your HSA account for payment, Rebecca. Yes. Hey, Christine says yes. Okay, and I apologize. There's 9 private messages here on the chat. I apologize. Okay, guys, we're trying to get to all of them. I promise I'm gonna respond to. Okay, so we want to recognize that we don't want you to feel normal. Quote, I'm sorry, say you're normal on labs, but you don't feel normal. The way that we conduct our evaluations is after the evaluation, we're going to run much more in-depth lab work than your other doctors trained in. Tell me let me explain an analogy. Tell me in the chat if you're a mother. You could be a father, you could be a big sister, but if you're a mother, just tell me. Tell me in the chat. I'm a little biased because I'm a mother. If you're a guy and you're a dad, or you're not a mom or a dad, but you understand. I'm going to tell this example. When my child says he looked everywhere and he tried everything and he can't find it, you better dang well believe I'm going to go find that object. Is that right, Mom? Maybe there's mom, dad, big sis, big brother, or just anyone here. Maybe you're a business owner. Maybe you're a manager. You just know when your employees said, I looked everywhere. And then you like go up and find it. Why could we find it, Mom? But my child couldn't find it. Tell me on the chat. Okay, we got Samantha's an auntie. Why can we find it, Mom or auntie? Why can we find it, but the child couldn't find it? When they tell me they looked everywhere. What mom or person wants to answer? Okay, so as we're waiting on that, I know where to look and I don't stop till I find it. Is that right, Mom? I always find it. My son lost his one shoe. You know how babies, they always miss one sock? I always find the other sock. I find it, okay? Because I don't stop till I find it. So in our practice, we, that's my body saying I need to drink some water. I speak for a living. I was doing an in-person event last night, so my body's reminding me to drink water. What I can tell you is that, oh, look at the bottom. Yes, determination, Katrina said. More thorough, Lori said, because we knew where to look. They don't even look. Yep. Okay, sorry about that. I had to scroll down. There's so many messages coming in. I bring that up because in our practice, we do such a thorough evaluation that we not only know where to look, but we don't stop till we find it. Tell me in the chat, why do you think most doctors aren't trained to look thoroughly like we do? Tell me in the chat why you think that happens. Okay. Rochelle said, you just keep looking. We're detectives. We're trained to look till we find it. Why do you think most doctors, Tatiana, you're right. Please tell me if I'm saying your name right. Is it Tatiana? Like, if you want to sound it out. I don't want to say your name wrong. Money. You're right, Rebecca. Yes. Thank you. Thank you, Tatiana. They don't care enough because they want to keep us coming back, Lindsay. Yes. They don't experience the same things. They don't care. Big business, big pharma. Michelle, you are on point. They get kickbacks from drug companies. You're right. All of you guys are correct. Okay. Medical school is essentially a way to be trained to be a legal drug dealer. Now, if you are a clinician, if you're a doctor, if you're a nurse, tell me in the chat. I'm not judging you. I'm judging Big Pharma, who funds 80% of medical school training. Okay, I promise. And then we know if you we actually work with a lot of doctors and nurses and all of that. We have a CNA, we have a nurse. There's no money in holistic. You're right, G. Okay. And I bring that up because this is part of why they're not finding the root cause, and they're just taught to push pills for every ill. Okay. Doctors, if you ask them for holistic, they like want to rip off your head. And then you ask them for more time, or you take their time. It's like they only have 8 minutes is what's covered through insurance now. Okay. This is what they do well. Someone had chest pain. They called Holistic Wholeness Institute the other day. We were like, dude, what are you doing? Please don't mess around with that. Call 911. Okay. You get in a car accident, you break your leg. Please don't call Holistic Wholeness Institute. Someone had pneumonia. They couldn't breathe. Please don't call Holistic Wholeness. Please go to 911. Okay. Please, let's be real, right? This is what insurance covers. Just like our car insurance covers, if you get an accident, health insurance is really like for an accident or cancer care. Okay. Or these really expensive pills and stuff. So there's not money in it, but we want to not do pills for every ill. Tell me in the chat, how many medications do you guys think the average American is on? That's right, Tamara. You said they never look at the whole picture. They just look at their specialty. Okay. You're right, Lindsay. You said 8. But a lot of you are right. Peggy, Laura, Lonnie, I hope I'm saying your name right. Lanie. I said 18, at least 5. The average is between 5 and 10. Okay. But that's including people that are not on any pills. The real average is 15 to 20. So you're kind of all right. Okay. My sister was on so many medications, she landed in the ER and the ICU from the side effects. Okay. Growing up, not cool. Our country, we spend $3.5 trillion on healthcare. 90% is on managing chronic health conditions that are otherwise preventable or treatable through lifestyle medicine and functional medicine like we do to get to the root cause and holistically overcome it for good. 70% of the deaths are from the top 5 chronic diseases that are otherwise treatable or preventable through lifestyle medicine like we do here. We spend the most in any other country. And what do you think our outcomes are? The worst. 70% of pharmaceutical dollars are from the US out of the whole world. We rank almost last for health outcomes, and we should really call it sick care. Tell me on the chat as we then get into the real good stuff of this webinar, why you're really here. Just tell me on the chat, how has your autoimmune condition or your health condition impacted your ability to work? Or impacted your ability to make plans, your migraines, your body aches, your fibro, your lupus, your RA, your MS, or keep up with little ones? Tell me on the chat, okay? Big time. Tell me L. Tell me Tatiana. As you guys are answering, Christine said all the time, I no longer able to work at all, Tamara said. We see that a lot. So that was actually Janine. As you guys are answering, I'm going to tell you Janine's story. She thought she was healthy. She was tired. She had Hashimoto's. She was on levothyroxine. Pretty normal. Okay. Single mom, working 3 jobs. Just thought it was normal to be tired. She's getting older, they told her. It turned into cancer. Tell me in the chat if you were aware that Hashimoto's can turn into thyroid cancer. Okay. Judy's still trying to work. Too many meds. I want to feel better, not be tired. Okay. So Tamara didn't know that. Tammy did know that. Okay. If you didn't know this, most cases of hypothyroidism are actually Hashimoto's, but not diagnosed because insurance and doctors won't cover or train to do the whole panel for your thyroid. They'll just do like one panel. They don't look everywhere, remember, just like my son doesn't look everywhere for his shoes. Okay, we got to look everywhere. And then Hashimoto's is linked to causing thyroid cancer. Okay, Rebecca said, yes, I knew that they removed my thyroid. So that was Janine. Okay, you could see her thyroid's like protruding out. It's taking up space. She had to go through chemo, surgery. And then we worked with her 5 months later. Look at her. She looks like she not only lost weight and more vibrant, but she looks like 10 to 20 years younger. She's in her mid 40s. She looks like 30. Okay. She's having peace of mind knowing that we got to get to the root cause of the Hashimoto's, the hypothyroidism, the autoimmune condition, the cancer, or the cancer comes back somewhere else is what we found. Okay. So the autoimmune issues, tell me in the chat which one of these symptoms you're having. Whether it's inflammation, some of you said, sleep trouble, fatigue, belly fat, weight gain, hormone problems, digestive issues. Tell me in the chat which one. I like to start with the gut. The gut is one of the main causes of an autoimmune issue. When there's a problem in the gut, it can cause something called leaky gut. And then basically when there's a low-grade infection, parasite, some type of dysbiosis, this can cause the gut to leak out the infection to try to get rid of it. But food particles leak out. The immune system attacks it because they're not supposed to be there. Food's supposed to be in the gut, and then it starts attacking the thyroid or the rheumatoid arthritis, joints, the heart, okay, the nerve endings, the myelin sheath, for MS, okay, mixed connective tissue disorder. That's like fibromyalgia, where these doctors are giving you some like BS name diagnosis. It's a real diagnosis, but they're not telling you the cause or how to fix it. They're just giving you what? Drugs. My dad would call them the legal drug dealer. They get you hooked on one, then you need another one, then you have the side effects, then you need more. No thanks. Okay. Not saying we're against doctors. We're not against medications. Don't think if you work with us, you should come off all your drugs tomorrow. That's not safe. But we do need to help get to the bottom of this, or we're not going to get ahead of it. We're going to just keep getting worse. Tell me if that makes sense in the chat. Okay. Tired and sluggish. Who's feeling these types of things? Who's feeling depression, anxiety? The gut is the mini brain. It's not just what controls your immune system, which is why part of you have this dysregulated immune system. Fibromyalgia is also linked to a dysbiosis in the gut. Now, that doesn't mean just take probiotics. We need to find what specific thing is off and then fix that. Let me use an example that'll make sense. My child is the cutest thing ever because he's mine, so I can say that. And I asked him to help me clean the house the other day. And I look behind me, and he has the toilet bowl brush, and he's trying to go near my dishes with the toilet bowl brush. Yes, I kid you not. He has the toilet bowl brush dripping toilet water over my house to the sink, trying to go near my dishes with the toilet bowl brush that was in the toilet just now. Okay. We need to find what part of the house is dirty because the toilet was clean, but now it's dirty, and so is my child, and so is my house. And then we need to use the right cleaning item on that area. Okay. We need to know what part of your house is dirty, your body, and then use the appropriate way to clean that, or you could get worse. Tell me in the chat if you understand what I'm talking about. You've tried to like take a probiotic or eat cleaner and like you just didn't feel better or you felt worse. Tell me in the chat if that was you. Okay. Because that's what we see every day. Yeah. Tina said. So this was actually Jean. Most doctors won't tell you to go holistic or functional, but we've actually worked with so many doctors that are practice members of ours that got such great results, and they don't learn all this in medical school. So they sent Jean and she actually got better. Okay. So tell me also other symptoms we see. Insomnia. Okay. Should you be waking up at night? Even if you're not insomnia, tell me if you have insomnia, but tell me should you wake up to go to the bathroom? Some of you should not be. Some of you are saying yes. The answer is no. When your hormones are normal, when there's not something wrong inside your body, you sleep through the night. Your body is supposed to sleep, rest, repair, digest. Rest, digest, repair, I call it when you're sleeping. If you wake up, it means your hormones are off or there's something in your gut wrong or a toxin present that's probably linked to also contributing to or causing your autoimmune issue or your fibromyalgia or your body aches or your fatigue or your lupus or your MS, but also it's waking you up to be like, alert, fix this. But you're like, I don't know what I should fix. I don't know how to fix it. Okay. So we make sure that when we work with you, we find that root cause and then show you naturally how to overcome it. So you're not just trying to put a Band-Aid on it and just take either medication or herbal things to try to sleep. We want to actually get to the root cause. Tell me if that makes sense in the chat. Okay. You could be moody because you're just in pain. You're tired. Gaining weight from steroids when you're having a flare. Anyone have that happen? Every time I had to take steroids when I had MS for a flare or for my psoriasis and eczema, and some of you said you have psoriasis, psoriatic arthritis, vitiligo, I had all those things. I literally would gain like 10 to 20 pounds every time. Okay. Yes, Samantha said. Margaret, my doctor says I have cold nodules on my thyroid. Yeah, that is not good, Madeline. That's a warning sign. That's almost like alert, like do something so this doesn't turn into cancer. The doctors will just monitor it till it is cancerous, then they'll cut it out. Let's not do that. Let's like actually get them to shrink, turn that around. We do that all the time. Okay. So this was Nancy. I know I'm Dr. Nancy Beliveau, but this is one of my practice members, Nancy here. We worked with her. She's across the country. And she had a bunch of autoimmune issues and gut issues, ulcerative colitis. I know some of you mentioned that. Mixed connective tissue disorder. So she had all sorts of musculoskeletal aches and pains and fatigue, fell asleep while working, couldn't work, but she had to because she was 70 and in medical debt. So she had to pay for these medical bills from other doctors and surgeries, even though she had insurance. She tried tons of programs, always needed one drug, led to another drug. We worked with her. She lost the weight for good. She lost 50 pounds, came off almost all her medication. Okay, not overnight. We needed to work with her for about a year to get her to that point. Doesn't happen in 1 month, people. But she said, I feel like I'm 50 now, not 70. Okay. That's what we want to see. Not this, right? Sick care model where we're stuck, missing information. We want to feel like we're sailing, not in this money-making model with more infusions, more drugs. We have to have insurance because we can't afford not to because all these drugs are so expensive. But what does insurance cover? Tell me in the chat. What does insurance cover? Does it cover natural, holistic things that actually get to the root of it or more pills and procedures to mask symptoms? Tell me in the chat. Natural, holistic, root cause, or pills and procedures to mask symptoms? What do you guys think? Pills, Madeline said. Fatima said pills. Yep, you're right. Never root cause. COVID was a great example of kind of who's pulling the strings here. We don't want to just survive every day. I tell it to every person I'm working with an autoimmune condition or any health condition. Let's not just keep surviving every day. Let's thrive. Okay. Let's not give more pills for every ill. Let's actually look under the hood. One more great example. Imagine you brought your car to the mechanic because the check engine light was on. And he's like, okay, I'm not going to look under the hood. I'm just going to give you Band-Aids that are covered by your car insurance for life. You keep coming back for refills every 3 months. And I'm just going to put a Band-Aid over that light so you're good to go. Doesn't look under the hood. And then your car seizes up one day because he never looked under the hood. And you just needed an oil change, but he didn't look under the hood. He didn't figure out why the light was on. He just gave you Band-Aids. And then we can't figure out why our body's seizing up on us and breaking down, why our car's breaking down, because no one looked under the hood. Does that make sense? Tell me in the chat, yes. Okay, so we want to actually do a deep dive. We book an hour and a half for your evaluation, and we want to really figure out, okay, we cannot stop aging, but we can be proactive. Let's do something now. not when this gets worse, not when it's cancer, not when I have multiple autoimmune conditions. Tell me in the chat if you know. Say yes if you knew this. When you have one autoimmune condition, it's linked to causing other autoimmune conditions unless you do something about it. Tell me in the chat if you knew that. Yep, Tina said yes. Lindsay said yes. Everyone's saying yes. Okay, so we want to really do that evaluation, and then the next step is ordering more in-depth lab work, more in-depth than what insurance covers, which is skim of the surface, because they won't find the root cause. They're in the whole cahoots with big pharma and doctors and insurance to just give you more pills. And we're gonna actually use food, fitness, supplements to actually heal the body. Okay, normalize that immune system. We usually see people feeling better from their condition, regardless of what it is. Oh, well, I have fibro and depression and MS and Parkinson's and mixed connective tissue disorder. I hear you. Okay, no matter what your condition was, we usually see an improvement in the first 2 to 6 weeks. And then what we usually see is in the course of 3 to 6 months, more good days than bad days, and we're starting to wean down or off some medications is what we usually see in our practice members. We collect a lot of data on our practice members. And then between 6 to 9 months, we're getting you to a point where you are feeling really good more often than not. You're on very little to no medications, depending on your case. And now we can just see you once a year for a more thorough checkup than your doctor. Okay, so you can just really feel like you're living your life. Okay, so how do we do this? Remember, we do the evaluation. We're going to run some more in-depth lab work, and then we're going to take the body through a detoxification, nutrition and fitness plan, address stress and hormones, and really make sure you have a mentor to put it together and customize it to you. Now, before we go through that, we like to talk about how did we get here. Okay, when we talk about how did we get here, like what is the root cause of the condition, I like to use Patrice as an example. Patrice had lupus, RA, fibromyalgia, and she had cancer twice. The immunosuppressing drugs caused her to be more susceptible to cancer and tuberculosis. Tell me in the chat if you've ever seen that or experienced it yourself. I did, so did Patrice. She worked in a lab, so she knows that they're not very thorough, even if your doctor takes 7 or 20 vials of blood. And she's like, I can't just keep doing the same thing and expecting a different result. I keep getting more pills, more surgeries, more cancers, more autoimmune conditions. We worked with her. She's on her second marriage because her first marriage ended because he didn't want a sick wife. Tell me if that's you. I felt like when I had MS and I couldn't walk and I had cancer, I was like, no one wants to marry a sick girl with cancer in a wheelchair that may not be able to get pregnant one day is what I was told, right? Very depressing. Very depressing. Madeline says yes. Okay, so I bring that up because we worked with her. She's on her second husband. She has a great libido, great energy. She's on down and off her medications. She did not get cancer again, and she can keep up with her grandkids. Okay, so what do we do first? We do an evaluation, and then we find, okay, let's figure out what root causes do we think are at play here. It could be some type of a trauma, as well as food-related stress, an injection, a side effect from a pill. It could be from a pesticide, for example. It could be from a low-grade infection or Lyme disease. It could be from a gut problem. Those are links to autoimmune issues. And then autoimmune issues almost always happen in women. The most common time that they're diagnosed is when hormones change. So Lindsay, you mentioned how your hormone, like 26. Women's hormones change every 5 to 10 years. So most people, yes, like juvenile RA, for example, can be diagnosed in your teens, right? When you start your period, but most women, it's actually perimenopause. Perimenopause is about 10 years before menopause. It depends on the person, but about that. So somewhere between like 30 and 45 or so. 40 is like the average I see. And most doctors don't recognize this. They're not trained in this. Why? There's no money in it. There's money in getting you sick, keeping you sick for life, okay? Not saying men can't have it, but almost all autoimmune issues have a gut toxin and or hormone component, okay? Certain hormones store fat and cause your body to store fat, others burn fat. And then certain conditions like heavy metals, sensitivities, Mary, I think it was, forgive me if I said it wrong, Mary, I think you said you had gluten and then you had mixed connective tissue issues, you noticed that, okay? But things like celiac, what caused that? Oh, it's genetic. Less than 10% of health conditions are genetic, okay? Oh, well, that's what my doctor said. He's his top specialist. He was taught to tell you that there's no root cause. It just happens as you age. There's no way to figure it out. It's genetic. 1 to 9% of your health is genetic, is what epigenetic studies reveal. Why do you think doctors are told to taught you there's no root cause? It's genetic. There's no way we can find it. Tamara said, interesting. Why do you guys think that is? Vanessa said, the rheumatologist told me I got RA hereditarily from my dad who had it. Why do you guys think that doctors are told to teach you it's hereditary? Let's see if I can scroll down. No one's answering it. I'll help you out. Then, do you ask any ins? I'm not sure what you mean, Janine, if you want to ask again. So let's go through that. Doctors are taught to tell you that it's hereditary. Erica got it. Thank you, Erica. Money. Samantha got it. Money. If they tell you it's genetic, then there's nothing you can do but take the pill for the rest of your life. And Tamar got it. It says Tamar here. In case easy to treat. You just take a pill. You keep you medicated. Okay. We're not saying genetics don't play a role, but they play the smallest role. Your diet, lifestyle, and your environment. Epigenetic studies reveal that plays a bigger role than genetics. That's exactly right, Felicia. So that you think there isn't much you can do. Okay, so we need to do, there's thousands of things that can cause your autoimmune issue. Glyphosate, which is a pesticide linked to MS, Parkinson's, fibromyalgia. There's so many things it could be. Okay, we need to find that root cause. Remember, I look, because I know where to look. Don't stop till we find it. And then we know how to treat it. Because remember, if we just try to clean the dishes with the toilet bowl brush and we drip toilet water through the house, and then the toilet wasn't clean, it was clean, and then now it's dirty because we just made a mess. Like, if we don't know what the root cause is, we need to know what part of your house is dirty, what part of your body is dirty causing this, and we need to know how to clean it properly. Not just like guess, we test. Tell me if that makes sense in the chat. Okay. That way you're going to have a scientific, data-driven approach, and that's why we always see results. The only way you won't see results is if you don't do anything. If you do nothing, I can guarantee, here's my guarantee. You want a guarantee? I have a money back guarantee for you guys. If you do nothing, I can guarantee nothing will happen, but you keep getting worse or keep dealing with what you're dealing with. That I can guarantee. There's my money back guarantee. But I can tell you, if you do your part, we've never seen someone not improve, come down or off meds, have more energy, their autoimmune markers come down every time. You don't do any work, nothing works. If you believe it works, you do your work, I can tell you we always see changes. Okay. So the doctors are just taught, like, what drugs do they need, right? Let's talk about Medicare and insurance. Medicare is the government insurance that dictates what other insurance companies privately will cover and not cover. So because of this, government, Medicare, states that care that prevents disease, promotes health, and prolongs and enhances the quality of life is not medically necessary and therefore not payable. Let's just read that one more time. Preventing disease, nope, you don't need to prevent disease. We don't need that. Promoting health, you don't need that either. We're not going to cover that. Prolonging, enhancing the quality of life. Nope. We'll extend the quantity of your life from the average age of 30 or 50 to 70 to 80, but your quality of life is going to go down as the quantity goes up. You're going to be on more and more pills, and you're just going to be really depressed and lots of pain in a wheelchair on your infusions. Do you guys agree with this? I don't. This is what they cover. Like we said, guys, keeping you sick, wrong and lacking information. Drugs, $535 billion spent on copays is a 50% increase since 2010. Karen, this yoga studio owner we worked with, she's like, I had thyroid issues for years. I didn't know that they were linked to causing sex hormone issues, which caused my breast cancer. I had been on this RA drug and lupus drug, which caused me to be more susceptible to cancer. We worked with her. She's keeping up with her granddaughter, Penelope, here. And she's down and off all her medications. She's now on the lowest dose occasionally of her thyroid med, but we're working with her to get her on a more natural alternative. So it's like, let's not just do more and more drugs. Let's actually do something different. Tell me in the chat if you're willing to do something different. Tell me yes. So sinking, let's sail. Okay. I ask you not just to do it for you, but to do it for who depends on you. So tell me in the chat, who depends on you? Here's my baby I was told I would never have because I had MS and an aggressive type of cervical cancer that they said when it comes back will be more aggressive. They literally said, okay, we got it all the cancer, but when it comes back, we'll be more aggressive, right? Thank you, Tatiana. My family. Madeline said my family. Elle said my family. Yes, my family and friends. Wanda, Samantha, my family, right? Parents and dogs. I love it. Here's the husband I thought I'd never marry because I was a sick girl with cancer in a wheelchair. Here's me teaching my baby to walk after I told I'd never be able to get pregnant. And I could never walk again, probably. We're not sure. I'm teaching him to walk. Okay, I ran a marathon the year after I was diagnosed with MS because I worked with a doctor that does what I do, and I was not going to accept that diagnosis. I said, thank you. I'll do this treatment now because I can't walk or move my head or breathe well. Clearly, sometimes you need meds, people. But then I worked with someone that gave me a different prognosis and diagnosis that said, no, you actually have glyphosate poisoning and Lyme disease and this and that and heavy metals. You have a gut problem. Let's fix that. And within a year, I was a totally new person. And that's what made me be this kind of doctor. I said, I want to be this kind of a doctor. So let's break through the terror barrier, not be chained to our health problems, and let's form a plan that's custom to you. The first step is detoxification. A lot of toxins are housed in the liver. This affects blood sugar problems, fibromyalgia, autoimmune conditions, Hashimoto's, vitamin D issues, mixed connective tissue problems. Okay, ulcerative colitis, there could be a problem in the gut causing that issue. Let's find it, not just keep suppressing the immune system, giving you drugs. So when we say detox, we need to really look at these systems, and we see the vitiligo improve, the psoriatic arthritis, the psoriasis. The gut actually controls a lot of these systems. So we want to look at that gut health. We want to do a complete microbiome analysis of the stool to figure out what do we need to detox? What nutrition do we need to repair these tissues? You can still eat out, still have fun. You're not going to be like eating coconuts and plucking the feathers of your chicken you raised to eat for dinner. Okay, we're not doing that. If you want to, that's fine. That's great. But like, we're going to eat out, have fun. We're going to do fitness. This doesn't count, people. This is real. We can't help this person, people. Do you see this slide? He's told me he was walking his dog for exercise. Can't help him. So we got to do real fitness. We're going to figure out what you like to do. Make sure it's something that's doable for you. You don't have to do headstands. Okay, if you want to do headstands, you want to do ultra marathons, you're a Iron Man or Iron Woman, that's fine. We work with those athletes as well. That's cool. But you don't need to do anything crazy. Okay, we need to do detox, nutrition, fitness. We need to look at your hormones. Tell me in the chat, where do you store your body weight? Is it in the belly, the legs, a little bit everywhere? Are we getting this PowerPoint presentation? No, but you get the recording, Wanda, after, so you can get it that way if that helps. Okay, belly, thighs, belly and legs. Okay. Okay. Hips and belly, gut. Okay. Belly. All right. So we want to figure out why you store your weight there. Okay. And we're not going to be blaming genetics. It's usually something else. And we got to look at not just routine lab work that doesn't get to the root cause. We got to do a deeper dive. Ginny was a nurse with fibromyalgia, chronic fatigue, lupus, RA, obesity, diabetes, cholesterol, blood pressure, you name it. Okay, she was on disability. Tell me in the chat. Some of you mentioned I can't even work anymore for my health issues. Are you like Ginny, a nurse? You can't work anymore, or you had to take an easier job. You're on disability. Tell me in the chat. She is a single mom of 2 kids, so she barely made $1,000 a month, I want to say, and she could barely keep ends meeting with that limited funding. Okay, we work with her to not only find the root cause. Of course, we work with any budget. So like if you're like, I'm a single mom, or I'm retired, or I have like barely any money, that's fine. We'll work with you. Because if your health is a priority, we'll find a way. If your health is not a priority, you'll find an excuse. Okay, so we worked with her and we just really taught her how to fix this. And now she doesn't need us anymore. She actually started her own microgreens business. So now she's promoting health, not pushing pills on people. And she's doing really well. She's like, if you wouldn't fly a plane by yourself because you're afraid you would crash it and die, don't try to figure out your health by yourself. She's a nurse, so she's not an average Jane or Joe. She knows a lot, but she really wanted to make sure she has a mentor, because she's like, I wouldn't fly a plane myself. I don't know what I'm doing to fix this, and I'm not doing well. So we worked with her and she's doing great. So we need a mentor. So in the program, we don't know what your program will need. We need to do an evaluation. It's going to include everything you need so that there's no financial surprises. We'll make sure that you have everything you need and that it fits in your budget. Is that fair? Tell me in the chat, is that fair? Okay. We're going to make sure we do an evaluation. We figure out what lab work we need, what detox, nutrition, fitness is going to work for you based on your lab work, based on your preferences, based on your condition, and then really pull it together and make sure we stick with you until you're like, I got it now. I'm doing great. It's like the GPS. You know how when you guys use a GPS and you're like, oh, I'm going to turn it off. I know how to get home from here. Okay. We're going to work with you until you're at that point where you're like, I got this. I'm coming down off meds. I'm having more energy. My brain fog is gone. I'm sleeping through the night. I got this from here, Dr. Nancy. I got this now. I'm good. Right. And then we just see you for like an annual checkup. Okay. So we really have a very systematic approach to take you from sinking to sailing. Okay. So in a moment, we're going to push out the 15-minute free consult, because I want to make sure you guys realize you can change the future of your health. We can order the right test, find the root cause, not just mask the symptoms with medication, and really treat you as a whole, not just look at one little body part and like you're just getting more pills. Okay. Dr. Leslie Hayes is an endocrinologist, and she's like, all I do is put people on diabetic and thyroid meds and steroids all day, no matter what autoimmune or thyroid or diabetic or what condition they have. And she said, you guys worked with me. We worked with her because she had a bunch of health problems. And she said, you guys taught me how to not need medication. And now she sends us tons of practice members. She's great. Okay. We want to recognize that your crisis could be an opportunity. I know it sucks. I know some of you may feel depressed, hopeless. I want you to know I felt that way too. I know this may sound a little grim, but I wanted to end my life because I felt like there was no hope for me. Being cemented to a couch, feel like every day I was hit by a ton of bricks. I looked pregnant, all these medications. I had no life. And I didn't want to be here. And I want you to know if that's you, you're here for a reason. You're hearing me say this to speak to you, to know you're not alone. There's other people just like you that we see every day. There's no shame. Book the free 15-minute consult. I'm going to put the offer out in a minute. So we don't just tell you and show you, we involve you so you can understand. Can't ride a bike without getting on, right? Take that next step. I can't do it for you because I have news for some of you. In case you're identifying as a cat, you're not a cat. You're a human. Yep. You don't have 9 lives, people. You just got 1. So don't procrastinate. Don't wait till it's too late. Real quick. We had this OBGYN we worked with, and she was diabetic with MS, all these brain fog, exhaustion. She fell asleep at work so many times. She'd sleep through lunch, and she lost her job because she could not keep her eyes open while working with patients. She was on 32 medications. Her husband was ready to divorce her because he just never saw her. She was just always sleeping, no libido, no intimacy. And her kids didn't have a mom. She just survived her workday and then would go to sleep. So we worked with her. She came off 32 medications. She's now on between 1 and 4. She reversed most of her autoimmune issues, if not all. And she just needs 1 to 4 depending on what she's at. So she's not oh my gosh, perfect. I just saw her the other day. She's doing so much better though. And her kids and her husband thanked me. They said, thank you for giving my mom back. She got a new job, promotion, all that. But don't wait till it's this bad where you're dealing with cancers, your thyroid's taken out. We could still help you then. But let's do something before then. Okay. Western's medicine job, your health insurance is to keep you alive. We're here to help you thrive, not just drugs, pills, and surgery. Okay. Let's do something different to get something different. Okay. Are you going to leave your health to chance or make a change? You're going to hope you figure it out, see another specialist? Why don't you just go for it? Okay. Before you book this free call, before I put out the offer, guys, before you book a free 15-minute consult with us, I like to ask this question. Show this slide again. Can I help everybody? What do you guys think? When you see this slide, can I help this person? The specialty labs are not covered by insurance, but we'll work with you on your budget to make sure we can make it budget friendly. I cannot help this person. So when I put out this offer, there's 205 of you on right now. Okay, I do not have 205 spots. I have about 20 spots in the next 2 days. Okay. If you do not get a spot when I put this offer out, which I'm going to do now as we're wrapping up, let me put this on and let me see if we can put this on. I'll put this on now. All right. Can you guys see that? Yep. Okay. So snag your free 15-minute consult there. If you want to go do that now as we're wrapping up, make sure you show up. Do not take a spot and then not show, and then there's someone who didn't get a call. Okay. This free 15-minute consult leads to an evaluation with us. The evaluation is normally $287 for the hour, but we knock it down to just $87 when you book the free call now. We take $200 off. The free 15-minute consult is to hear what you're going through, see if we can help, see what you've tried and not tried, and we'll be straight up with you. Okay. It's a free consult. If we feel like we cannot help you, we will tell you. We're not going to waste your time. We're not going to waste your money. If we feel we can help, then we're going to book you for an evaluation, of course, with your consent. And the evaluation, like I said, is just $87. And you're going to be set up for an hour and a half with one of our providers to really do a deep dive, figure out what's going on, where do we need to look for the root causes, and come up with a plan. After the evaluation, we're going to work with you and work with your budget. Is that fair? Okay, tell me in the chat. Yes, that's fair. Yes, that's fair. Okay. And we're going to make sure we form a plan that's going to get to the bottom of this, help you overcome it for good, teach you how to fish, not just teach you how to be dependent on us. Okay. We want you to need us less and less, not more and more. like the doctors want. So go ahead and book that call. I see a bunch of you booking now. The spots are filling up. There's only a few left. If you do not get a spot and you need one because they're filling up very quickly, just drop us a message either in the chat or text us or drop us an email. We'll make sure we help you with that. Okay. This is about you not ending up here, another hospital stay, infusion, cancer, all that stuff, ending up here on our schedule. If it says no times available, click on the select a time area and you should see some more options. But if you don't, like I said, just drop us a text or an email or message us in the chat and we'll help. Okay. Put your phone number in. We're going to text you. Remember to show up. Okay. Now let's go through a couple things that are important. After the free 15-minute consult, the evaluation with us, if you're married or you live with someone, you're going to want to have your partner at your hour-and-a-half long evaluation. Now, I know you're like, oh, well, he works or she works, or that's a big ask, or our schedules don't line up. It's important. Just this first visit, we found that if we're going to work with someone, we need to know not just from them, but from anyone that's living with them, what they're seeing, what they're feeling, what they've noticed. We want to know that. Also, there's a time commitment and a financial commitment. And we don't know what we're looking at. You could need a simple oil change. When we look under the hood, that's $20. You could need a whole new car. And if you would buy a car without your partner's consent or talking to them about it, then sure, you can book without your partner. Okay, but if your partner doesn't have to get evaluated, but they need to be there. Okay, but if you, and we're not looking at the price of a new car here, people. But if you wouldn't buy a car or a house without your partner looking at it and talking through those finances, then have them there. Because we're not looking at the price of a car or a house. When we're talking about your health, we're looking at making sure something fits into your budget. And if you share finances with someone, we want to make sure this works for you guys. Is that fair? We'll form something that fits into the budget. You're not paying for a car or a house. We're investing in your health. Okay. Does insurance cover what we do? What do you guys think in the chat, guys? Insurance does not cover what we do. Okay. Janine said definitely can't afford this time not working. So Ginny on this slide here, right here, was not working. Okay. That is not a reason that we can't work with you. If you have a phone, you have a house you live in, or an apartment, you have a car, how important is your health compared to your phone, car, house, or food on the table, or electric? How important is your health compared to Wi-Fi? If your health is just as important as Wi-Fi or more important than Wi-Fi, we can find a way to fit it in your budget. Is that fair? Okay. So insurance does not cover what we do, but we can work with you no matter what your budget. Ginny was making $800 a month on disability. Okay. Gloria over here was making $1,100 to $1,200 a month on Social Security, $1,000 to $2,000 with her husband, Social Security. We can work with that. Okay. We don't know what your program is looking at, but we can promise it'll be all inclusive. So there'll be no financial surprises. The lab work, the visits, everything's bundled in. And I don't know what you're looking at today. I have nothing to hide. Please don't ask me or on the free 15-minute consult. We don't know, but I can promise you by the end of the hour-and-a-half evaluation, we'll know exactly what we're looking at, and we'll make sure that that fits into your budget, whether it's a big budget or a small budget. Is that fair? Yes. Okay. What about telehealth? How do you do this in the comfort of my home? We work with a national phlebotomy company, so we can get a phlebotomist to your house the day and time you want. They'll draw your blood there, stool, urine. Hopefully you can hold your own cup to pee in. And we're going to look at those specimens and make sure that we're much more in depth than what your doctor or insurance or typical skim of the surface stuff is doing. Okay. We'll get to the bottom of this so we can make sure we overcome it. What about if you've tried other things and you're skeptical? That's fair. Is giving up an option? Oh, I'm not going to try this. I've tried so many things that work, so I'm just going to stay right here. Is that really safe? No, it's not, Tina. We work with people in Hawaii, Sheila. What's the highest price anyone's had to pay? I don't know that answer off the top of my head, but I can tell you, Janine, is that if finances are a concern for you, what we can do is make sure that we form a plan that fits into your budget. Is that fair, Janine? Tamara said, never an option to quit fighting. So that's right. But then sometimes you just can't fight anymore. So we can promise you that if you're skeptical, that's totally normal. But what if it does work? What if it does work like thousands of other people we've worked with? What would that be like for you? Do you believe you're worthy of feeling good? Do you believe you're worthy of living your life, not just surviving? I do. Book that free call. Okay. You are worthy of not just surviving and leaving your health to chance, but making a change, like me and my sister and thousands of others. Book that free call now. The spots are running out. Some of you may have, yes, I'm a functional medicine doctor, Janine, and Tina wants her life back. Very good. Book that free call now. The spots are filling fast. If you don't get one, I'll stay here for another minute. Would a local holistic doctor do the same thing? No, Christy. If I can get my health back to where it was 8 years ago, a miracle. Donna, I have them all over my desk here, but I have a whole poster board of them. These are all cards from people. I get them every day of people that said this was a miracle. I have these are just the 3 that came this week. I have thousands over here on my wall because this is what people say every day. So it doesn't have to just be me. Okay. How are we notified of our free call? I booked it, but didn't receive any confirmation. It should go into your email, Lindsay. And you should get a text. Okay. I'll look out for you, Lindsay. If you want to put it in the chat, your last name or your phone number, I'll check for you too, hon, or even very different than a local functional doctor. Tamara, I don't know. It depends on who you're talking to. What people tell me, Tamara, is that we actually get results. And most local functional doctors are not actually functional doctors. They're just like, oh yeah, we're going to run all this through insurance. That's a red flag right there because insurance will only cover about a $9 to $11 lab panel, which is not going to find the root cause. And then there's unexpected fees and things. So I'd say the biggest difference, if you guys want to check us out, look at our reviews, all that, Holistic Wholeness Institute, and put NJ, even though we work with everyone everywhere, you'll see our clinic. Our reviews are just really high. We just have a very high success rate. So you kind of get it. How soon do you get results? Usually it's in the first 4 days to 6 weeks. Most on average, it's 2 to 6 weeks. You think it was Friday, Tammy? Okay, I'll check for you, hon. Okay, you can't get a date and time available. All right, I apologize, Anne. We might be full. Okay, I'll look for that, Donna. Are you located in New Jersey? We originally started in New Jersey, Janine, but now we work with people all over the globe. Okay, great. Any other questions as we're wrapping up? I see your email. Okay, I'll take a look at that. And this chat is saved, so I'll be able to check in the times. Okay, as we're wrapping up here, I know some of you are jumping off because you're doing it. We're full because you're unable to get one as well. Okay, I apologize, Lindsay. Okay, you didn't get a confirmation. Check your email. Of course, Tamara, you're welcome. And we're going to send an email to book a call. We'll open up a couple more spots for you guys, okay? You'll get an email and a text. You book for tomorrow, but not in an email, Judy. Let me see if I see you there. Hold on, let me hit refresh real quick. Looks like all the spots are full. Hold on, give me 1 second, guys, as we wrap up. Oh, yeah, all the spots were taken. That's why, guys. All right, I'll talk to my team. They're done working for the night, but tomorrow, okay. Sorry, guys. I'll tell you why. All the spots are full. But this is what I'll do. I'm going to talk to my team. We meet in the morning at 9:30 Eastern time. You're in 1:30. Okay. And I'll have them open up a few more spots for early next week. Okay. 2:30 tomorrow. Yeah, I see you here. See you here, G. All right, guys. God bless. Have an amazing night. Can't wait to see you. And you're worthy of feeling good. Take care, guys. Bye.